Governor Ademola Adeleke has officially inaugurated the governing board of the Osun Health Insurance Agency in a bid to bolster the agency's performance. The governor, who was represented by his deputy, Prince Kola Adewusi, underscores the administration's commitment to enhancing healthcare access for all residents of Osun State, regardless of their tribe, social class, age, or political affiliations. Adeleke, who highlighted the administration's dedication to prioritizing the health and well-being of every Osun resident, emphasized the significance of paying premiums to ensure the healthy living of citizens across the state. He, however, enjoined the newly inaugurated board to work in synergy for the success of the present administration.
Occasions like this is a joyful one, and it is a very big assignment that has been given to all the board members. The executive secretary has reeled out all the achievement of OEs, and I believe you are taking it off from them, the board members. You were not around when you were doing all these things, but now that you are constituted, I'm expecting a better or best performances again from the board. It is a very big task, but I know with the caliber of people that are just been sworn in now, I don't entertain any fear at all. Jokingly, I was telling Mrs. S, I said, oh, all your Mrs. all your papers will take days or weeks. So thank God, finance is there, and all the permanent secretaries, directors that are there. Nothing more to say than to wish you well in this new assignment, and we want to see a better performance from OEs now that you have been inaugurated today. So we have done the swearing-in ceremony. I want to wish you all the best in your tasks ahead. May God Almighty continue to guide every one of you. We cannot be as many as this, and we won't have little use amongst ourselves. The majority you have been using in handling your respective ministries, please put it in use when such matters arises, so that we won't have a conflict of interest and opinion that will turn the whole place upside down.
Executive Secretary of the Osun Health Insurance Agency, Dr. Razak Akindele, expressed gratitude for Governor Adeleke's administration's efforts in ensuring that even the less privileged members of the society have access to quality health care. He noted that the initiative has garnered attention from 7 other states, inspiring them to adopt similar strategies for enrolling pensioners into health insurance schemes. Akindele assured members of the public that the board will do its best to make Osun health care stand out among its peers.
We are here today. Of course, I don't think there is anybody here that has not heard about OEs. If not before, in the last few months, we have heard quite a lot about OEs. And that is not, this would have been impossible if not for the law that the executive governor of Osun State has for that agency. His Excellency, Senator Ademola Adeleke, he has given us maximum support in that agency. We, towards the end of the year, commissioned the new office complex that he completed. The complex was left abandoned. He completed the complex. Just immediately after that, he gave us the marching order to enroll all pensioners in Osun State. That has never happened anywhere in this country. Recently, in collaboration with Rotary International, the governor also approved the free surgical intervention for pensioners. That we did in about 6 weeks ago, and the turnout was tremendous. Other programs are on board. We intend to enroll all people living with disability according to the directive of the government. We also intend to enroll all people with sickle cell disease into the program. We intend to enroll people living with HIV. We have even started that. We have started the enrollment of the first 100 people living with HIV. So, I want to encourage all of us here. There is nobody that is not linked with one well-to-do person or the other. Please let us encourage them. If all politicians register 100 people in their constituency, 100 people will translate into 1.2 million in a year. If all politicians register 100 people in their constituency, I'm sure Osun State will be better off. If we give Okada, that is 900,000 to an individual, that 900,000 can register 90 people for healthcare for a whole year. Not that Okada is not good. If the Okada man is riding and he has an accident, what takes care of that Okada man? So why we are here is to inaugurate the board, the governing board of Osun Health Insurance Agency, which our program is Osun Health Insurance Scheme, OIS. That is the one that is popularly known. And it is a leading insurance agency in this state. Our pensioners enrollment, 7 states have copied us since we did the pensioner enrollment, and other people are following suit. People have come to Osun to study what we do at Osun so that we can use it in their state.
The newly inaugurated board members include Dr. Muyiwa Oladimeji, Chairman, Dr. Razak Akindele, Secretary, Dr. Akim Bello, Mr. Najim Akintola, Dr. Abayomi Oni, Mrs. Yetunde Esan, Dr. Olufemi Ogundun, Dr. Olufemi Allah, Comrade Christopher Arakpasokpo, Mr. H.O. Oyawoye, Mr. Oluwole Fabiyi, Dr. Gbenga Adepoju, Mr. Stephen Aremu, and Mrs. Omolara Moshood. The inauguration marks a significant milestone in Osun State's healthcare system, symbolizing a concerted effort towards achieving universal health coverage and ensuring the well-being of its citizens.